And that takes us to number 3, Sever's disease, something that we see commonly. Very similar process to Osgood-Schlatter's, where the weakest link in this chain is that growth plate, 2 to 5 times weaker than the surrounding tendons. And so if something's going to give in an adult, it's going to be Achilles tendinopathy. But remember the parts of that bone up at the top, we have the epiphysis. The physis is the growth plate, and then the metaphysis and diaphysis are the bone below. That we have that jelly physis, really, that's allowing where the growth is occurring in that bone in an adolescent. Until it closes, that's where bad things happen. Most of the time, these are kids who are active. They're challenging that. They're at an age where that is still jelly-like. It is still growing. The growth plate is not closed. More common in males, and not surprisingly, bilateral, because the same stressors are usually happening to both legs and the lower extremity. Upper extremity problems are often unilateral because you have a throwing arm. Lower extremity problems are often bilateral because you have running and jumping legs and feet. Sever's, like Osgood-Schlatter's, usually the start of a season that just ramps up unless we can change that ratio between breakdown and rebuild.
And once again, rest is one of the number one things. Remember with Sever's disease, just like we saw with tibial stress syndrome, is you can check that out in Chiro and be able to access all the videos. In fact, why don't we go ahead and do that? Because I'm going to.
This is the evaluation, I think.
Oh, we have the evaluation first. Ah, there we go. So I love orthopedic tests. It just makes sense. So obviously, if you have a bone issue, we're going to want to squeeze it. We're going to work it. We're going to move it. With the heel squeeze test, we're going to actually create compression of the calcaneus. Now, one of the most interesting protocols that we've ever put together, mostly because we just had the geniuses in the profession put it together, like Dr. Bashaw, is that the calcaneus, do you know how thick that cortex is? It's not very thick at all. In fact, it's very spongy, so it's able to move. It's very fluid. It's able to absorb ground reactive forces. So unfortunately, when you put some squeeze into it, it's going to make the entire thing bow. Well, if there's a bony lesion there, you're going to feel it. So in this case, you're just squeezing the medial and lateral side like you're seeing here and looking for reproduction of symptoms. As you can imagine, if I had an Achilles problem, if I had plantar fasciitis, those wouldn't be exacerbating that symptom. And also take into consideration that while the Achilles tendon is pulling from the proximal end and the distal end of the plantar fascial problem, that where is the weakest point in an adolescent? It's not the muscles, it's not the ligaments, it's not the fascia, it's the bony attachment. Now, remember, whenever we see this, when I saw that, when I was in school, I'm like, holy cow, what is that? Remember, we have growth plates. So as an adolescent, we're going to see a gap there. We may even see some some fragmentation in here. That is normal. Some people will look at both sides, look at what's normal, and maybe a widening of that growth plate is indicative of a Osgood-Schlatter's, indicative of a Sever's disease. When you see that pulling away. However, with a lot of lower extremity issues, like Dr. Burleson said, it is bilateral. With Osgood-Schlatter's, you are going to see a little bit more with soccer player on the dominant leg, and you're going to see with basketball players and jumpers on the non-dominant leg, and it has to do with just the way we jump in our cross-crawl mechanism. However, most common is going to be bilateral. Just like we saw in the other lower extremity issues, we need to do some soft tissue manipulation with the Gastroc and Soleus and our exercises. We can just do a condition report.
Yeah, or where would I find these exercises? So we're going to stretch out the gastroc and the soleus. We're going to strengthen the plantar fascia. We're going to strengthen the posterior tibialis. We want some core and hip stability, certainly. And here's where it happens.
Oops. Condition reference, and we're doing Sever's now. You know,
nice work.
I'm not even going to try to spell the whole thing. Instead, I'll just spell a little bit of it, and that way I won't make a mistake. That seems to work pretty well. Internet's working as fast as my brain on a Friday. So same thing that we saw in every other condition. So we're going to get the evaluation with the heel squeeze test. We're going to get the management as far as things that we can do to help with these patients. And we'll talk a little bit about that at the end of this section. But then also the exercises. And once again, we need a way to deliver these exercises. In that kind of case, what you're going to do is you're going to find your patient. So with my patient, we just created a fictitious patient. His name is Brandon Steele.
He's pretty fictitious.
And as long as you have their name and their email, that's really all you need. And what you're going to do is you're going to enter in their diagnosis. In fact, someone asked me this weekend at a seminar. I said, so how do you use chiro in your office? I'm like, I don't. I said, I don't have time for that. My staff does. So I go up to my front desk staff and says, hey, Jen, I've got Sever's disease. They go into foot and ankle. and they're going to find Sever disease, or you can just search for it if you just want. Everything's alphabetical and searchable. And then it's going to pull up all the evidence-based recommendations. It's going to give them all their exercises. It's going to give them my personalized treatment plan for that condition, along with their primary care doctor that I've already entered in, so I can get their initial report and release report. And now that I have all that information, I can save it. And the reason we have save here instead of print, email, or how do I deliver this is people have different needs. My 14-year-old probably has an iPhone. I'm just going to send him an email. My 80-year-old probably doesn't. They're going to want things printed, emailed, and probably told them 17 different times, which is why we created Cairo Up. So if you want to create a little more efficiency in how you deliver information, that's what this is created for. So now what you're going to have is, if this was your clinic, it'd have your clinic name. You're going to have a chart copy of exactly what exercise you gave to the person. You're also going to have an initial report to give to a medical doctor. Here's exactly what I'm doing with your patient. This is the best form of marketing, just good doctoring that you can do, having that line of communication with their primary care doctor. It's also going to have in 6th grade language, what is Sever's disease? That way little Johnny goes home and he can tell his mom, his dad, and his coach exactly what's happening with him. All the things that we're going to do to him. We're going to do all these different things to him. Once again, all this stuff is modifiable. If you do different stuff, you do dry needling, you do DNS, you do McKenzie directional therapy, you do anything you can put in your own information to make it yours. So now you can automate the things you have to constantly tell people. What is good footwear? How do you educate someone on running shoes? They're also going to have the ability to scan and see exactly their exercises, or they can go into their app from their iPhone, or there's some people that still use Androids, right? I think
Couple.
they can just see their exercises, or I just pulled it up here, which are the same exercises. Here's what's on mine. So it comes, this is me as a patient. It comes from my clinic, Premier Rehab, and all my exercise that I need to be doing. Here's a great way to take everything that you know about a condition, diagnose that person, treat that person with the way that you see fit. Of course, taking the evidence in mind, but also taking in your experience that, you know what, maybe there's some more things I can do for the patient. And now you're going to give them the best patient education to hopefully let them manage the condition along with you. Remember, this is a situation where it's not just us. We're not the one treating this condition. It requires myself, the patient, and also the parent. So everybody needs to be on the same page.
What I love about it is I'm able to, in very quick, within a couple of seconds of telling Jen up front, here's the report that I want. I can deliver that information. I can deliver these ADLs. I can deliver the exercises with video demonstrations, so I don't have to go through them all carefully. If the patient understands what's going on, the patient is going to have access to that long term. They're going to rate my care. I'm going to see my outcomes. My most satisfied patients are going to be sent to Google. And most importantly, I, as part of that network of 2,200 providers now in 15 countries throughout the world, are sharing our best practice recipes. So if I've modified something on my protocol that helps us get better outcomes, we're able to harness that. And remember, these 3 conditions that we're talking about, there's much to be learned. It is a lot of anecdotal evidence, unlike some other conditions, which are pretty straightforward. And the way that you and I can make a difference in changing that from anecdotal into real data is by working together in a network like this. I hope that you'll consider joining us. At least sign up for the trial so that you can access the videos, but hopefully you'll like it enough to stick around. These are the ADLs that you've probably been able to read through as we've been going. And Sever's disease is something that, like many other things, we just need to let the bone have a chance to recover before we put too much more stress on it.